there is 3 design lessons that stand out for me after the years that I've been working on this topic. The first one is to treat stigma as a fixed feature of the landscape that you're designing for, and not just an obstacle, temporary obstacle. If your product requires people to access it publicly where they might be seen, or to perform stigmatized behaviors to maintain it, the take-up is going to be low, even if it's free, even if it's clinically superior. And for example, with Remy, these drying washing bags, it was not an afterthought. It was core part of the design from the beginning. And I think this is important. Then building on this, a second important point is the last meter of distribution in this domain in menstrual health is very important, because we develop the perfect product that solves a need that women have. And then we see that a large share of people don't take it up. And you can think, yeah, they just prefer something else. And that might not be the case. So in Bangladesh, we saw that the product was there. It was fantastic. Sometimes it was even free, but because the shopkeeper was a man, women were really disencouraged to get the product. So thinking about this last meter, so thinking how and from whom are people going to get the product is very important. And then lastly, I think, and I've seen that information alone is not a silver bullet. There's now a large body of research showing that information changes what people know, but not necessarily how people will behave. And information is essential and it should be there, especially if you're developing a new product, like let's say menstrual cups. People need to understand how to use them. But if your whole strategy lies on the assumption that once people know better, they'll do better, it might not work. So I think the successful stories are those people that bring structural change together with information. And this structural change can be in the product, can be in the distribution, can be in who is in the room. And then they partner this with information, and knowing that information and this awareness will take long, very long to change things.